For years, the term pain management has carried a stigma, often tied to misconceptions about dependency or quick fixes. But today, experts are showing us how the field has evolved with modern approaches that treat the root cause and also give patients their quality of life back. Joining us today is Dr. Neil Amin from the Advanced Relief Institute to break down what's changed and why getting help doesn't have to carry the stigma that it once did. Welcome to South Florida Live.
Thank you so much, Kristen. Thank you for having me today.
I just want to start with the first question. Why do you think that pain management has carried such a stigma for so long?
You know, it's an unfair connection to be made because pain management physicians didn't start the opiate crisis. A lot of these prescriptions were being written by other types of physicians, and we were actually on the forefront of preventing from this happening. So it's a mislabel, and it's unfortunate, especially in South Florida, but we're certainly overcoming this.
So how has it changed?
Sure. We are doing a much better job of informing and educating the community on letting them know what pain management really does, which is really to empower patients on why they're having pain and treating it in a way that's tailored and specific to them, and not really focusing on opiates or even surgery and preventing unnecessary versions of both.
So what are we looking at then as far as pain management is concerned and those advancements?
Sure. I mean, you know, the biggest thing is when you're finding the right physician, because the definition of pain has the word emotional experience in it. So if you're not connected to your physician, it's going to be very hard to get a great outcome. And also just through technology, like the advancements in ultrasound machines and x-ray machines, even the type of thin needles that we use, it's incredible. The medications have advanced. And finally, the techniques that we use, some of the advanced procedures that we offer are incredible.
So for someone watching right now and they're thinking, well, I have pain in my back, for example,
Sure.
What would you tell them to do?
Sure. I think the biggest thing that I would recommend is to not wait. The urgency of the treatment is extremely important because we had this kind of mindset in the past of like, oh, you got hurt, you should lay in bed for 7 or 10 days, take some ibuprofen, but we're way ahead of that. You know, there's a word that I like to use in our clinic, which is called active recovery. It's having the patients activate their recovery and having a specialist like us to help them formulate that plan. So an example that I give is oftentimes patients initially will go to a chiropractor, or they'll go to a physical therapist, or they'll go straight to surgery. And pain specialists that are double boarded certified like us, we can actually help tailor that plan because it should be based off of timing and necessity, not because it's like the reflexive thing to do.
There's help out there. Thank you so much, Dr. Amin, for being here on South Florida Live.
Thank you.